Thank you, Mr. Chairman. I am proud to offer my amendment to support efforts to prevent and treat global malnutrition. The World Food Program estimates that a child will die from malnutrition every 10 seconds. Malnutrition causes 1 in every 5 deaths among children under 5. These are preventable deaths. USAID helped implement evidence-based preventions and treatments for malnutrition, including ready-to-use therapeutic foods like Plumpy Nut, made by Adhesia Nutrition in Rhode Island. Plumpy Nut can save a child from severe acute malnutrition in as little as 6 weeks. This is more than just life-saving treatments for people around the world. They support American farmers by using U.S.-grown food products. They use peanuts from Georgia, milk from Wisconsin, soy from Iowa, and commodities from 15 other states. In short, they support good-paying jobs in Rhode Island and across the country. When global nutrition programs stopped because of President Trump's foreign aid freeze, American workers lost their jobs. American farmers are struggling to survive right now without USAID contracts purchasing their crops. Unfortunately, the bill before us does nothing to fix these issues. The bill blindly codifies Trump's deadly cuts, falling far short of providing the resources needed to fight malnutrition. Instead, the bill would hand the implementation of our malnutrition treatment programs to the State Department that lacks the expertise, contracting ability, and resources needed to handle these programs. USAID has had dedicated teams of experts working tirelessly around the world to bring people back from the brink of death due to malnutrition and prevent others from facing malnutrition. The State Department does not have the expertise nor the resources needed to lead the fight against global malnutrition and support manufacturers and farmers here at home. My amendment would reinstate our malnutrition programs within USAID where their staff has decades of experience. It's where we have qualified individuals to actually provide the treatment and the prevention of malnutrition. My amendment also authorizes the prevention of malnutrition, unlike the Republican bill, which only authorizes emergency treatment. That means Republicans are waiting for a full-blown crisis before taking action. The competency of those in charge has shown our farmers cannot wait, our workers cannot wait, and starving children around the world cannot wait. When children suffer from malnutrition, it can lead to severe health issues that stay with them for the rest of their lives and require continued medical treatment. We can do more than treat malnutrition. We can prevent it, and we can support American farmers and workers. It's just the right thing to do, and that's plain, that's simple. Instead of blindly going along with whatever President Trump and Secretary Rubio suggest, let's focus on what works and treat malnutrition effectively. We can get this done. I urge my colleagues to support this amendment, and I yield back.